Hi, my name is Amy Whitby, team trainer here at Teeth Tomorrow. We put together a video of the questions that we get most asked. When a patient connects with your office, that is the first touch they have at finding out if that's going to be the proper dental home for them. It is going to be super important that a series of questions are asked to the patient to see if you fit their lifestyle and they fit yours. Patients want to make sure that you have what they need, that they could trust you, and that you're going to be the right office for them. When the phone call initially rings, you want to make sure that Steve answers the phone on the first ring, Tracy answers the phone on the second ring, and I get the phone on the third ring. If there has to be a fourth ring, that would then turn over to the call center. When a patient calls your office and the phone rings more than a few times, they'll most likely hang up and find another location. One of the main challenges I find with dental practices is how their phones are initially answered. I don't think people realize that a patient can feel and hear when you're bothering them. So if you answer the phone with, "Thank you for calling Teeth Tomorrow, this is Amy," the patient can feel that I'm not happy to receive their call. Or if I change it and say, "Thank you for calling Teeth Tomorrow, this is Amy, how may I help you?" That's going to change the patient's feeling with how they communicate with me. And if I hear on the other end of the line that the patient definitely is scared or not happy to talk to me, it's going to change my tone, because if I match their tone, then we stay in the same level. If I come off to the patient as being too excited when they're calling me in pain, that also can turn off a patient. It will be very important for you to show the patient that you have empathy and concern for their situation. When your office answers the phone, it will be important for them to use a telephone information sheet. This is a sheet we could help you create, or you may already have one in place and it just needs to be fine-tuned. It is going to be very important to have systems in place, and one of those systems would be scripting. You do not want your team to read a script directly word for word. You want it to just flow naturally based on the patient's initial question. You may want to say, "How long has that been a concern for you? What concerns do you have for the doctor?" You want to make sure that the call center and the office can handle both of these situations the exact same way. When Steve answers the phone, it will be important that he finds out if he's able to help the patient. So what he's going to do is ask the patient their name, try to gain control of the call right away, find out what the patient's needs are, and then he'll put the patient on hold and say, "Tracy's the person in our office that handles all of our implant questions. Would it be okay if I placed you on a brief hold? Connect with her and she can help you from there." It's very important that the patient feels a proper handoff so they don't have to keep repeating themselves every time they talk to somebody different in your office. You'll want to ask patients questions like, "What concerns do you have for the doctor?" Once they answer the question, it would be time for you to prompt them with the next series of questions. What insurance might you have? Do we have time constraints that we need to focus on? So if you find out that your patient's getting married in 2 months, they're going to be a priority to get them in and make sure all their needs are met. You can ask them, "Do you have a specific day and time in mind?" And you can tell me, "Have you ever had any type of experiences at the dental practice that may have caused fear? And can you tell me more about that?" So when you ask them leading questions and try to find out a deeper level, you're going to be able to treat them in a different way. You're going to know that the patient maybe needs to be in a private suite. So this way they don't hear noises going on outside the office or around their appointment time. You want to make sure that the patient comes back rather than go hide for another 5 years due to fear. You can ask them, with everything that we've talked about today, is there anything else that I missed? Do you have any other questions that I could go over with the doctor prior to your visit? All of these things will make that patient gain rapport with your team right away and trust you and know you're the right fit for them. When you find out a patient has fear, the best thing you can tell them is, in your office, we make sure that the patients are comfortable from the start of their appointment till the end. And we make sure that they don't hear anything, they don't feel anything, and they get to just take a nice gentle nap, wake up, and it's all over. Those are the benefits to coming to your practice, is it's done in one state-of-the-art facility with having one doctor, and all their needs are met under the comforts of sedation. Having one person in your office be the direct liaison to that patient is also a key benefit. If they call your office and they ask directly to speak with that person can be the one factor that calms them down and keeps them coming back. Then they'll refer their friends and family, and it's a win-win for everyone. The best way for your team to handle anything that has to do with price is to tell the patient that unfortunately, without us meeting you and having the doctor do a complete examination, it's impossible for me to quote fees over the phone. I won't even know if that's the correct treatment for you, let alone what that fee would be. Once you meet our doctor with a complimentary consultation, he then can do necessary x-rays and an exam to find out what best suits your lifestyle, your needs, and your budget. When using and choosing a call center, it's going to be very important that they act as a direct extension to your office. This way, the patient never will know that when I pick up the phone at the call center that I don't work in your location. What they're going to do is ask the patient a series of questions and tell the patient, would it be okay if I put you on a brief hold? At that time, the call center is going to call your office and ask if they could directly connect you to the patient. They're going to hand off to you just the way it would happen in your office from team member to team member. They will tell you the patient's name, what their concerns are, what their insurance is if they have any, and telling you that the patient wants to come in today or tomorrow. So this way, when you get on the phone with the patient, you could do a quick recap, making sure you have everything correct. And then the patient right away establishes that rapport and knows that your office is 100% on point with what they're talking about. You're going to want to choose a call center that will try to connect with you during business hours all day long, making sure you don't ever lose an important patient. After hours, you would set up parameters with them. So if a patient called and said, I'm in pain, or I would like to have dental implants, they would call either the person on call, which could be a team member, or the doctor, and state to the doctor that I have Mr. Smith on the phone. He sounds really eager to start dental implant treatment. Would you like to connect with him now? Or should I just take down his information and send it to the office to connect with him in the morning? This way, no matter what, you get to choose what's important to your practice and what's important to your patients. We have found from different studies and just hearing from teams across the United States, the longer you wait to call a patient back, you most likely will not be able to get a hold of them within a few weeks and sometimes even months. Thank you so much for watching our video. I hope you enjoyed it. Connect with me at your earliest convenience so we could set up a meeting and have a discovery call and figure out what would work best for your office.